Step 5, you want to milk the finger, and it's best to hold the finger in a downward fashion so the blood will come to the tip of the finger. Step 6, use the alcohol wipe to clean the tip of the finger. Step 7, open your lancet and push it down on the finger. The pushing down motion releases the needle, which will stick into the finger. Please do not stick the patient on the very tip of the finger, as this is the most painful area on the finger. Immediately place the lancet into the sharps container. Never, ever lay your lancet down. All sharps immediately go into the sharps container once they have been used. Step 8, milk the finger to get the concentration of the blood at the tip of the finger. Step 9, bring the patient's finger to the strip, which is embedded into the glucometer at this point. Put the blood on the strip until the machine says stop. Some of them beep, some of them start flashing. You'll know. Step 10, put the gauze on the patient's finger and apply the Band-Aid if needed. Step 11, when the machine has completed its reading, document the results in the patient's chart. Step 12, place the patient back in the exam room. And step 13, tell the doctor the patient's ready and the results are available. CBC, which is a complete blood count. Phlebotomy, which is venipuncture, is required in order to obtain a CBC. Let's cover the basic phlebotomy protocol first. Please understand that the instructions provided will assist you in drawing blood. However, until you have successfully drawn blood into the collection tubes, you will not completely understand all of the steps. This section is intended for those who need to be cross-trained in the process of drawing blood to work in their offices. Phlebotomy. Let's cover some terms. Venipuncture is the action of entering into the vein to draw blood and obtain a specimen. Phlebotomy means the needle cutting into the vein to obtain blood. Phleb is vessel. Otomy is cutting into. Vein, that is your blood vessel. It has blue blood in it because it has deoxygenated blood. It turns red once it hits oxygen. Vacutainer tubes. Match the test with the color of the tube top, and we'll cover that under order of draw. Vacutainer needle, needle holder, tourniquet, alcohol pads, cotton ball and gauze, and a Band-Aid. Vacutainer tubes, color tops and order of draw, tourniquet, and order request. Please see the video for phlebotomy. These are the steps you want to follow every single time for venipuncture. Number 1, explain the procedure to the patient. The patient needs to know that the physician has ordered blood work and that you will be drawing blood from the patient. Collect your materials. Vacutainer tubes, the needle, needle holder, tourniquet, alcohol pad, cotton ball or gauze, and a Band-Aid. Step 3, place the tubes in the order of draw based on your lab protocol. Once again, refer to order of draw. You want to apply the tourniquet, examine the arm and select the probable site, which is generally near the bend of the elbow. You want to clean the site. Now, to clean the site, you want to begin at the center of your location and work your way out. Pick up your needle and turn the bevel, which is the eye of the needle, upward facing the ceiling. Step 8, using your index finger and middle finger, you will put those on one side of the needle holder and your thumb on the opposite side. Then you enter the vein with the needle at a 30 to 40 degree angle. Remember to have the bevel up. When you feel that you are in the vein, and you should feel a pop once you have broken through the vein, hold the needle holder extremely still. With the opposite hand, grab your first vacutainer tube and insert it into the needle holder and puncture the rubber stopper. The blood will be sucked into the tube. Step 12. When you see blood, you want to reach up and release the tourniquet. If you keep the tourniquet on the arm, you may actually hemolyze the blood. Hemolysis actually means that the cell is breaking down, so you will actually contaminate your sample. Step 13. When the tube is sufficiently filled, Remove the tube and grab the next tube and follow the same steps. When all of your tubes have been drawn, pick up your gauze and cotton balls. Remove the needle and then place the gauze or cotton balls over the site. Remember this, please. Please do not hold the gauze or the cotton balls on the site while you are removing the needle. You run the risk of sticking yourself or cutting yourself, and then you will have contamination of your blood. This is very important. Step 16. Have the patient hold the gauze and the cotton ball for a few seconds, and then you apply the Band-Aid. The next step, which is 18, you want to gently tilt each tube to mix the material in each bottle. You do not want to shake the tube. Okay, you're going to gently tilt the tube for 8 to 10 times.